Hi, I'm Dr. Kenny Levine. Welcome back to Health Talk. I'm here with Dr. Brad Ginzler, who's talking about contemporary endodontic therapy. You know, you mentioned the CT scan, Brad. I know I have sent patients to you because as a surgical specialist, there are times when I would like a CT scan to look at specific areas of the mouth, and you've helped me tremendously in being able to diagnose and locate the specific position of teeth, the amount of bone around teeth. How do you use it in your practice?
So I take a scan of patients if we're going to do treatment, and typically on a retreated tooth I will always take a scan, and on an initial treatment I'll take quite a few scans as well. I had a patient who came in today for a treatment on a lower molar. It seemed like it was going to be a routine treatment. When I took the scan, I noticed there was a radix root. I'm not sure if you're familiar with a radix, but it's an accessory root that projects off of the other main root. This root would probably have gone missed without the use of the cone beam scan. So in an axial view, looking at a tooth from head to toe, we can take different sections of the tooth and really examine the root form, which again guides and eases our ability to treat the tooth.
You know, it's been explained to me, like when we take conventional images of teeth or radiographs or x-rays, we see what's called a periapical lesion or a dark area at the tip of the root. And it always looks like a round circle to us. But with the cone beam CT, you have the ability to see whether it's just the cross section of a hot dog and a much larger lesion than we would see otherwise.
Which can also determine whether or not that tooth should be treated. Where again, in previous endodontic training, you see a small area on a radiograph and you may be inclined to treat that tooth. With the cone beam image, I may see that small area in 2-dimension and bring it into 3-dimension, and it can go from a 2.5 to 3 millimeter lesion all the way to an 18 millimeter lesion. In that case, I may be inclined to tell the patient, this is probably not a good tooth to save. Chance of success is pretty low. This tooth is better off removed.
You know, you talked about keeping teeth and saving teeth. We talked before, you know, one of my pet peeves is a periodontist. As a periodontist, my whole heart and soul is to keep people's teeth. Unfortunately, there are other periodontists who look at periodontal disease as a disease of titanium deficiency. Too many teeth are being taken out in our community and replaced with dental implants. I spent 2 and people spent 3 years of training on learning how to save teeth. And again, my goal is to keep people's teeth in health and function and good aesthetics for the remainder of their life, if possible. If not possible, then we have implant options. I know with modern endodontic therapy, you can keep teeth that previously couldn't keep before.
Certainly, and that goes to the question, what's a hopeless tooth? And really, you know, that question is yet to be answered, I think. There's no good rule for what is a hopeless tooth. It's definitely hopeless once it's out.
That's true, it's gone.
Right, but until then, there are lots of ways that we can try to, both periodontally and endodontically, maintain the existing dentition, which is really, I think, important.
You know, when I look at a tooth today or look at teeth for my patients today, I say, well, if I do everything that I'm talking about, whether it be periodontal surgery, root canal therapy, caps and crowns, is that tooth going to be there for 7 years? Can I guarantee that patient is going to be there for 7 years or 10 years? And if I can't, then we have some discussion. Is it worth all the treatment that we're going through to keep that tooth for possibly less time than what our goal would be? And many patients will say, you know what, I don't have a tooth out. I would like to keep my tooth for as long as possible. As long as possible is a nebulous term.
Sure.
Because to some people that means for the rest of their lives, and some people it says as long as possible. They may realize that if they can keep their tooth for another 3 years and postpone losing it to a dental implant, then that's okay with them too.
Yeah, and I agree with that as well.
You know, it's interesting because patients say to me many times, am I too old for this procedure? You don't know this, but my implant career began in 1985 with my wife's grandpa. Grandpa was 85 years old. We did 2 dental implants for him, and they lasted for another 7, 8, 9 years, I forget, until he was, you know, until he passed away, and that changed his life. But, you know, I tell patients today, the only time you're too old is if your physician tells you don't buy any green bananas. With that, we'll be back in just a couple of moments. I'm Dr. Kenny Levine with Health Talk. See you in a minute. Thank you.
When you're smiling First impressions are priceless.
I'm Dr. Kenny Levine. For the past 37 years, we've been helping patients of all ages restore their smiles. Today, with modern technology and lasers, we're able to treat infants of 7 days old. We treat their parents. We help them not only keep their teeth, but restore function for the rest of their lives.
Call 954-603-7109.